Well, thanks. I just wanted to give folks a breaking news update that we learned about on June 18th. It is Juneteenth today, so I'm really excited I get a chance to speak with folks about this. It's been nearly a decade that Aetna, CVS Aetna, has been really recalcitrant in requiring that a PT get an order from a non-PT, essentially they have a list of folks who could order physical therapy. That was the only way that folks could really get to it. And the thing that is frustrating about that, well, two things. One is that Aetna, CVS Aetna covers close to 36 million people. They would call them covered lives in insurance speak. And so that is a significant chunk of the insured population in the United States. It's Medicare Advantage, it's private plans, it's Medicaid, it's plans that list in the exchange. All these things, employer-based services, or paid-for services. It is all across the country as well. Aetna is one of the five large BUCA plans, which is the Blues, United, Cigna, Aetna, and Humana. And so very important that this advocacy happened. It really happened as a result of multiple things. One is the advocacy that physical therapists and the APTA did to try to get Medicare to recognize that another provider didn't need to order physical therapy, that in every single state in the country, there is some form of open access for physical therapy. Physical therapists can be the first point of care for patients in every country, every state in the country now. Those rules are a little variable. They change state to state and in DC. But generally, there's some recognized strategy or law in particular for PTs to be the first point of care for folks who are injured, et cetera, musculoskeletal conditions. Aetna did not recognize that, and that really reflected Medicare Part B's strategy, which is the sort of traditional fee-for-service Medicare program. They really only recently allowed for physical therapists to be the first point of care in the Medicare program. And that was published in the last draft fee schedule, the one that's applicable to this year, and then finalized in the final rule. PTA orthopedics repeatedly commented in support of this change to the Medicare program, both in the comment to the fee schedule and in recent comments to, of all places, the Department of Justice and then HHS. And the reason that we commented to DOJ was that they were interested in anti-competitive behavior. There's an antitrust perspective division within the Department of Justice that sort of overlaps with the Federal Trade Commission. Basically, they were asking for things that created red tape, right? And this is a prime example of folks being impacted in their access to physical therapy, even though state law allows them to get in, Medicare wouldn't, right? And so until they changed this policy in the last fee schedule that's applicable to this year, really there was a very important speed bump before folks could get into physical therapy in Medicare Part B. Medicare Advantage, of course, is a different program. It's administered by HMOs generally, and large insurers like those BUCA plans, Blues, United, Cigna, Aetna, and Humana. Now, because Medicare shifted their policy, there was really very little solid ground to stand on when every single state has some structure that allows access to physical therapy as a first point of care. And then additionally, once Medicare finally changed their policy, we had a very good argument to go to the plans and say, look, we've been asking for this for a decade. Every single state does it. Medicare finally did it. What are you guys waiting for? And why are you limiting access to such an important healthcare intervention that, by the way, will save patients money, save you what you would call medical losses or what I would call healthcare expenses. Essentially, they finally gave in. I want to credit APTA's advocacy on this. Again, it took almost a decade to get this done, but that is why, even though it doesn't seem like immediately you're going to see a lot of results from this work, you have to keep at it, right? And APTA can't do it all for us. APTA would not have gotten where they did but for the work on the Medicare fee schedule, as well as the work in every single state to allow access to physical therapy as a first point of care. And it's just an indication that this is sort of a wave that can roll once you start pushing that water, right? Pushing the water uphill is what it feels like sometimes, but eventually it can really crest and change policies nationwide. We do want to make sure that this works in every single payer, large payers or small payers. Medicare is generally the way that we can get payers to change their policy. If we can change Medicare policy, then we can go to those payers and say, hey, we made this change in Medicare, so why don't you make this change too? I think that's why Medicare is such a focus in DC for advocacy. Again, it's not automatic that it happens if Medicare changes their policy, but it provides a very strong basis for us to advocate for better access to physical therapy, better access to orthopedic physical therapy, and really, basically not only provide more visits for PTs, but also provide better care for those patients who are suffering. So that's the point of all this, is to try to let folks in the door so that they can get the best care provided by physical therapists as opposed to surgery or other sorts of interventions. That there's no delays in that care, which is what things like the signed plan of care and other impediments create. And as we all know, the faster you can get into PT, the generally the better the outcomes for those patients. So big news. Basically we're going to keep pushing to try to have this happen with every payer. We're actually going to try to get even more done with Medicare beyond this signed plan of care requirement. We have some other policies that we recommended in the Department of Justice comment, as well as in our comment to the Health and Human Services request for information. So both of those are available, and we'll put links for them in some of these the comments sections. But right now, important news, and we're just very excited that we're able to bring this to you in such a timely way. So kudos to APTA for their long-term, tireless advocacy. Basically it prevails, the persistence prevails when so much else fails. And that's what advocacy is all about, is just making your argument until somebody listens to you. And then hopefully the policy will change. So good news that happened.